Hey guys, we are back talking about the brain. All right, so we're starting with the cerebral cortex. Now this again is what we think of when we think of a brain. It's that wrinkly top portion that most media, most Hollywood, most movies, whatever you want to call, would show as the actual brain. Now the brain is much more complex than what is portrayed, but this is what we think of. And the cortex is going to be contain a lot of different areas. You've got your parietal lobe, you've got your frontal lobe, your temporal lobe, your occipital lobe, your sensory cortex, and your motor cortex. It's that all of that is contained. We don't know every single thing about the brain because the brain is ever changing. And it's also hard to study. I'm gonna move you, I'm sorry. But here is what we do know. We do know, keep moving you just for a second. There we go. All right, we do know that it's going to be the top of the head towards the rear, and this is gonna be the senses. We know the frontal lobe is going to be speaking, movement, planning, judgment, reasoning. This is the last, again, to develop fully, which is why impulse control is so hard. It's also one of the frontal lobe is the one that's going to be affected the most by illegal substances, and people really want you to be careful and not do those things because of the it's going to be the issue. It's going to become an issue. Even if just one use can become an issue later in life. You've got your temporal lobe that's receiving the information, and the brain is very weird in how it is set up because of where it connects in your spinal cord. And that's definitely shown if you look at, pretend your fist is your brain, and you're going to, there we go. You're going to do it like this. I don't know if you guys can see it. You're gonna flip it. So the left side of your brain controls the right side of your body, including your ear. The right side of your brain controls the left side of your body. And that's hard to grasp sometimes, but it is going to be how it works. And it's also going to, there's a school of thought, if you're right-brained, you're more detail-oriented. If you're left-brained, you're more art-oriented. You've got the occipital lobe. It's at the back of the head. That's for all of your visual stuff. Don't get smacked in the back of the head. Be careful if you fall. Just make sure that's protected. That's why helmets are so important. You've got your sensory, which is part of the parietal lobe, and it's the top of the head, and it's interpreting information. So not just receiving it, but also interpreting, and that's a big piece you have to focus on. You've got your motor cortex, and that's in your frontal lobe as well. And it's just on the top of the head as well, in the, and that's your motor skills. So you have to, all of these pieces you have to put together. So when you're looking at your hemispheres, like I said, it's called brain lateralization. Left brain people are more artistic, righties or right brain people are better at logic. And there are a lot of different schools of thought that are good with this. They can disagree on a lot of different things, but they do focus on this. And this has been shown through injuries and things like that. This part isn't going anywhere. All right. This was Phineas Gage. It's a video. I will post it. This is something that they actually were able to use like 100 years ago to study the brain without actually opening somebody's brain up. This guy was working on the railroads and he got shot through the skull, and this was actually a depiction of what happened. Just his skull, not his face, obviously. And what the people who are around him are eventually going to say is before he got hurt, he was one way, he was an easygoing guy. But after he got hurt, he became angry. And there's a lot of different reports because people don't write things down correctly, and, you know, scientists and stuff. But there is a consensus that afterwards, even though he survived, he was different. And brain injuries, you can survive, but they're hard to get through. A lot of brain injuries, you don't know how they're going to affect you until later in life. And that's been a big thing moving, especially in football, concussions and such. But it's also something that injuries to the brain, they do on purpose, especially if you have like a brain tumor or something like that. When they go in and they either cut out the tumor or they give you chemo and radiation. And so what they do, or what they've started to do, is also send people who have brain injuries to a psychologist or a psychiatrist just to make sure that there's no negative effects, and if there is a negative effect, they can catch it early enough. All right, so neurotransmitters, we've talked a little bit about this, but these are the chemicals within the brain that make the neurons go crazy, kind of. And a lot of them have double or triple the meaning. The ACH, I'm not even gonna try to say that word. That's your gross motor skills. That's moving your hand, that's running, jumping, all of that stuff. And it has been linked to the Alzheimer's disease. There's a lot more research being done on how to help that, and if there's a chemical or a drug way to encourage that to come back. And again, a lot of these, if you're going through something good, maybe this is going to uptick and it's going to help to remember something. But if you are losing it, or it's decreasing in your brain, that's what's going to be linked. Now, this is not causation. Remember that there's a difference between cause and correlation. This is a correlation right now. Now we've got dopamine. Dopamine is going to be used in a lot of different ways. Again, still, these are small motor skills. So fine motor skills, writing is a big one, and alertness. Illegal drugs can increase your dopamine or decrease your dopamine, and that's gonna cause issues. There are two different diseases that are linked. Remember, watch the words, linked. Parkinson's disease, which is shaking, and then you've got schizophrenia, which is the high manic and then the low depressive. Now, the problem with messing with any of these chemicals, these naturally occurring chemicals in your brain, is that if you take some type of illegal substance to increase your dopamine production, your brain gets used to it. So if you ever stop taking that illegal substance, it's going to take a lot more for you to be more alert, to be happier, and that type of stuff, which is why it's such a big deal to not do these things. Your serotonin, this is, again, they all have a couple different jobs. Serotonin is mood control. Lack of serotonin is the clinical depression. Clinical depression means you have been diagnosed by a doctor. You have not self-diagnosed. And with these drugs, what we're looking at is, think of in your brain, the neurons are creating like a gateway, and this chemical is coming in, and it should open so the serotonin can go in, and then it'll close. Well, sometimes in your brain, those doors stay closed, all of these chemicals. And so you have to figure out a way through exercise, food, and then eventually through doctor prescribed medication, how to reopen those doors. Endorphins are a couple different things. It's going to be pain control, and it's also going to be included in the happiness as well. Now, most addictive drugs, illegal drugs, deal with your endorphins. Most people use drugs to stop feeling pain or escape or feel numb. Choose your verbiage. And what happens is the people who are taking the illegal addictive drug have to take more and more, and that leads to badness. And so you have to be careful with all of that. So you have a couple different types of drugs. There are many different more, but this is the three that we're going to talk about. So we've got the agonists. These are going to make those electricity between the neurons fire more quickly, to fire more often. You've got your antagonists, and that's going to stop them. So if you have too much, say, dopamine, then you are going to want to stop that on some level. And so if you don't have enough, you want to use doctor prescribed medication to help get more in your body. Now, the reuptake, these are going to stop things from being used because you want to make sure that it is correctly taken. And then you want to make sure that anything that you are taking is monitored closely by a licensed doctor. Caffeine is probably the most commonly used, and it's a blocker because it's going to supposedly help you stay awake. And it could be used for other things, but if you've noticed, if you drink caffeine, after a while, you have to drink more cups of coffee. You have to drink or more cups of soda to get the same reaction that you did. Now, this is the threshold of your brain. And with caffeine, it's the easiest to just stop. And then eventually, if you wanted to, you could enjoy it again. So we talked about Phineas Gage. Now, lesions. Now, these are little cuts. These are going to be most often used in brain procedures to take out a tumor, but it doesn't always have to happen that way. Accidents, car accidents, bike accidents, all of those can also leave lesions on the brain. Sometimes way back when, this was used to see if it would stop people from acting a certain way. There are very much less invasive ways to study the brain, and you may or may not have used these or seen these before. You've got your EEG, your CAT scan, your MRI. The MRI can be your whole body as well. Your PET scan and your functional MRI. Now, these are all you're usually awake for. Your MRI and your functional MRI, they're going to look at how the pieces of your brain are working together. So what lights up? So your EEG is looking at the electrical waves. This can also be used during a sleep study to see what you're dreaming about. Your PET scan, it's going to look at the radioactive form of glucose, so that's sugar. Glucose is just a fun word to say for sugar, and how you are working through a task at hand. Your MRI, it's going to look at your brain. It's going to look at it in almost in slices, and it's going to use radioactive stuff with it. This one says it's a schizophrenic patient, so you're looking at what is in the brain, what's happening in the brain, and then what is lighting up, what are you using the most when you're looking at something. So here we have the split brain. Now, I told you that doctors are going to use medical procedures to look at the brain, figure out the brain. It was also used in really negative ways. I want to say way back when, but that's not always true. Historically, split brain and, let's see if it's on the next one. Lobotomized patients are going to be forced into it, but not always. What happens is somebody is going to come in and cut this in between, so the left and right sides can't talk to each other, and you need them to talk to each other because of each side is going to control something different. Now, what this could look like is if you have split brain, so a person is looking at a dot, and if they have a split brain, they might not see the he. All they see is the art. So they're going to say the word on the poster board is art. But if you ask that same human to point at the word art, they're going to point to the he. Remember, this is visual and spoken, and this is gross motor. So what you have to have your pieces together to fully function. Now, that isn't always going to be practiced, and that becomes an issue later on. We've done that. We've done that. We've done that. I'm skipping it because we've done these. Plasticity is a big thing, and this is a joke that I make about my 5-year-old. He bounces, and that's kind of the same concept, except for this isn't, the neuron is going to be recreated, which means if you get hurt or if you forget something, you can recreate that. It also goes to the saying of old dogs can't learn new tricks. It's just harder. It's not that you can't learn something as you get older, it's just harder, and you have to put more effort into it. We've talked about it. So this is, scientifically, they say that the best way to study genetics is to look at identical twins, not fraternal twins, because they come from the same zygote or egg-sperm combination. And this allows for scientists to look at how personalities are created. It allows scientists to look at if I lobotomize one and I don't lobotomize the other, what happens. The worst case scenario for twins being studied was during the Holocaust, when Joseph Mengele would take people in concentration camps and do horrible, horrible things. Now, the problem is that modern medicine does use this, and it did push the science forward, but it was just a horrible way to go about it.